Okay, everyone, you're welcome to the Global Mental Health Peer Network Northern Africa Regional Webinar. And let me quickly say this, when I share to my network about what GMHPN is doing, and I say Northern Africa, I have people correct me and say, but such and such country is not in Northern Africa. So I will just state it that it's for administrative purposes, that within the GMHPN network, the African group is divided into Northern and Southern Africa. So I just wanted to state that for clarity. And so the title of our webinar today is Men Seeking Behavior for Mental Health Problems. And basically we'll be looking at the practices and the consequences of men being able to seek, help for their mental health issues. And I will also continue by saying that men matter. Our societies are built around the contributions of the men in our lives, our brothers, our fathers, friends, co-workers, and all of the men. So we need you for every man that is on the call today. We need you. We're proud to have you in our lives, and our societies are better when you are better. And so welcome, 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 welcome. Let me introduce myself. My name is Jennifer Dawat, and I am from Nigeria. I have the honor of moderating the panel discussion today. I have 4 speakers. I'll be introducing them. And when I know one person, my last speaker may not be able to say anything now, but when I introduce you, please just unmute your mic and say hello before we go into the discussion. So the first person I want to introduce is Mwathi. She is a facilitator and mental health champion. She's the leader of the youth network. She's a youth leader. She's a member of Youth Leader Network at Cities Rise, and she loves advocating on matters of mental health awareness. Please say welcome and say hello to us if you're here, Mary.
Hello, guys. Am I audible enough?
Yes, you are. We can hear you.
Okay, yeah. I'm Mwathi from Kenya. And welcome to the webinar.
All right, thank you. Thank you for being here. The next person I will introduce happens to be our chairperson for the Northern region, this quarter or this season. And he has worked behind the scenes to make sure that this webinar holds. He is none other than Jaleta Teressa from Ethiopia. He is a senior mental health professional and a part-time educator. He's here today as a member of the GMHPN network. Hello, Jaleta.
Hello, everyone. I'm Jaleta Teressa from Ethiopia. Welcome to our today's webinar. Thank you for coming to participate.
All right, thank you. Thank you, Jaleta. My next speaker is Deborah Omage. She's a public health practitioner as well and mental health advocate. She champions preventive mental health education for adolescents and young adults. Deborah tackles stigma through innovative initiatives and partnerships. She empowers individuals to prioritize their mental health. Deborah Omage is here with us today.
Hi, everyone. I'm Deborah Omage again. Thank you so much. I hope I'm audible enough. Thank you.
Okay. And my last speaker, I know he will not be able to say anything now, but I will go ahead and introduce him. He is Tanaka Maritim. He's a transgender man living in Kenya, and he's a mental health programs coordinator at Jinsiango and also a member of the GMHPN network. Tanaka, thank you for your time. I can see you're waving at us on the chat, so thank you. So like I said earlier, that we're basically looking at men's seeking support or men's habits around mental health, and there are facts to back up the fact that men are sort of the neglected portion when it comes to, or groups when it comes to mental health, especially within the African setting. There's a lot of push for, men to be strong, men to be, outgoing and all of that, but there's not enough conversations about men's mental health. And so today, as a region, we're trying to break through that barrier and hold this conversation. And Deborah, just because you're one of the persons that I'm looking at, I'm going to be throwing my first question to you, around what do you think is the culture or the cultural view of mental health in Africa? And how do you think that that cultural view is contributing to the health crisis that we face?
All right, thank you. So first of all, I would say that just like you rightly stated, mental health is often neglected when it comes to the men. And I just want to put it out there that mental health issues does not discriminate gender at any point in time. So talking about the cultural view of mental health when it comes to men in Africa, it's basically centered around three main things. One, which is strong masculinity norms for men, where there is traditional expectation of men to be stoic, for them to be unemotionless, for them to be self-reliant, which often leads to stigma when it comes to them seeking help. Most times, vulnerability is seen as some form of weakness. And then secondly, talk about spiritual beliefs. In Africa here, we hold so much value, so much accord when it comes to anything that has to do with spirituality. And don't get me wrong, I'm not saying that spirituality doesn't play a role in anything, including mental health. Yes, it does. But most times, some cultures attribute mental health issues to spiritual issues, which in turn makes them to turn to religious leaders as opposed to mental health professionals when it comes to handling these issues. So, like I stated earlier, don't get me wrong, yes, of course, spirituality plays a role, but there should be a place of, okay, it's time to handle this spiritually, talk to my religious leader, or even talk to God myself, and then there's a space of, it's time for me to seek professional help. And then thirdly, we talk about limited awareness. There is so much limited education and even open conversations when it comes to men's mental health. Most times, just like you rightly stated, men are brought up in a way to not show emotions, to not talk about their challenges. And so because of these things, most times they are not even aware that these are the symptoms of what they're facing. Okay, when I have this symptom, when I have that symptom, it means that maybe I'm on the edge when it comes to my mental health and I should see someone. So because of that, there's almost, they don't know when to seek help. They don't know when it's time to say, okay, I should do a little bit more of self-care and all of that. Thank you.
Thank you so much, Deborah. That was, insightful and a reminder that we should, support the men around us to be vulnerable. There's a second part to that question that you didn't touch on, just how this religious barrier, how this lack of vulnerability and stoicness, how do you think is contributing to the health crisis that we see?
Okay, so I would basically say that it's contributing to it in a negative way. meaning that it's not allowing people to seek for help when they ought to seek for help. Mental health here is such a conversation of shh, be quiet, don't say anything. So because of that, people don't seek for help at the right time they ought to. So therefore, I'll just primarily say, just like I stated earlier, actually, I think I answered that in between when I was talking, but just to say that it has reduced or basically make seeking for help when it comes to mental health on a low level.
Thank you so much, Deborah. Before I speak to the next speaker, I'll just re-echo something that Zach has put in the chat, that anybody on the call, you can ask questions and share your comment also in the chat box, and I'll read it out and re-echo the thoughts as I see them. Please, this is our webinar, so feel free to contribute. I'm going to bring up Jaleta up and ask the next question because, he's a man and I would like to hear from his perspective. So Jaleta, if you're there and you can hear me, would you share, especially from your personal experiences, what are some of the challenges that hinder men from seeking help? What are those barriers that come in the way of men trying to seek help?
Okay. There are a number of factors that prevent males from seeking help for their mental health problem. The first one is internalized stigma. Since there is a public attitude that seeking help for mental health is a sign of weakness or incompetency, men have internalized stigma for seeking help for their mental health problem or for their emotional problem. So this is associated with the cultural view of men's mental health. Especially it is common in African cultures. And the other one is lack of understanding about the mental health problem. The sign and the symptoms are lack of understanding about the sign and the symptoms for mental health problem or emotional problem is also one of the strongest factors which prevent men from seeking professional help. Because if someone is not understanding the sign of stress, the sign of any other type of mental problem, they cannot be motivated to seek for help. And also there are another factors which are public stigma, which is general for mental health problem, not limited to the men's mental health. There is a general stigma around mental health. So this is also one of the strong factors which can prevent men from seeking professional help or any type of help. So instead of and the other one is men, since they are considered as strong as self-reliant or independent, men are not encouraged to seek professional help for their mental health problem because seeking help is considered as a sign of weakness in our culture. So this can also hinder males from seeking professional help. So instead of seeking help for their mental health problem, men use another coping mechanisms like using a substance, like drinking alcohol, chewing chat, or any other form of activities, or they use some other coping mechanisms which may have another consequence on their physical or mental health. Also, they can use gambling or some other unnecessary games such coping mechanism can also hinder males from seeking help. So the lack of awareness is also another factor which can hinder men from seeking professional or any form of help. So when seeking help, when we say seeking help, it can be informal seeking help, which can be taken, which can be obtained from family, friends, or partner, or any other community source, or it can be a type of formal type of help seeking, which is obtained from professional or trained person, like counselor, psychiatrist, or psychologist. So these factors, the factors like internalized stigma, public stigma, and a lack of awareness can also are the factors which can prevent men from seeking help for their mental health problem. Thank you.
Thank you so much, Jaleta. That was, succinct. Thank you for, sharing as you were speaking. I remembered even before you started giving the examples, I was thinking of some of the so-called macho activities that men carry out, or engage in, like you said, excessive drinking. It seems like a manly thing until you now start realizing that these are just coping mechanisms to underlying issues. Thank you so much for pointing that out. I'm going to be bringing up Mary. Mary, if you're there.
Hey, I'm here.
Okay. Thank you again for being on the call. So I'd like you to just talk to us on some of the practices or habits that you recommend for men to, what are those things that men can develop in trying to combat or prevent mental health problems? Especially as someone who with lived experience also, I believe that what works for women also will work for men on a level, but also as a professional in the field, what are some of the things that you recommend?
Okay, thank you, Jennifer. So during my time online, I saw something, and I would like to share before I go to the things people should do when they have mental health problems or prevent it from hindering them. So I guess it's facts. So I noticed that 1 in 2 men will have mental disorder, and in 1 out of 3 men will have a substance abuse disorder. Okay, 1 out of 5 men will have anxiety disorder, and 1 in 8 will have mood disorder. That's what we call depression. So from this fact, we can agree and analyze that there's a large percentage of men with poor mental health habits, right? So not every man can say that, okay, this is my problem. As Deborah has said, a lack of information about certain symptoms makes men know that they are having some problems, some mental health problems. As a lived experience, there's some things I did that worked for me, and there's some things I did that didn't work for me as well. Okay, first of all, I would recommend regular exercise, and through regular exercise, someone will engage in physical activity, and by this, it reduces stress and improves mood. Another one is healthy eating. Okay, when you eat healthy and maintaining balanced diet, since it will provide essential nutrients for brain functioning. Okay, I don't think that worked for me, but I don't know. And then another one that actually didn't work as well is adequate sleep. When you prioritize getting enough sleep, sleeping at the right time and waking up at the right time, I think your brain just function on well. I guess another thing I'll like say is stress management. By this, you have stress reducing techniques such as deep breathing, doing yogas, meditating, and mindfulness. And by mindfulness, I mean by doing morning meditations and having affirmation each and every morning. Okay, mindful eating. Okay, you can even have mindful walking. You just get out of the house and start having a mindful walking. You can start by journaling, gratitude journaling. For me, I would like to say that gratitude journaling worked for me since I will start my day well with the affirmation and everything. Then later, during the evening, I'll journal everything that has happened to me during the day. Also, there is mindful technology use. You can limit your screen time. You can limit your time in your apps, in your technology apps and everything. Yeah, so I would highly recommend the stress management and stress reducing techniques. So another thing is social connection. By this, I mean you cultivate strong and social connection with family, friends, or even support groups. By this, you're able to talk to people around and telling them what you feel and expressing what you're feeling. Okay, so another thing is seeking help. You can seek help from professionals, and they can help you when the help is needed. You can go for therapy sessions, counseling, support groups, and by this, they can provide valuable tools and strategies to manage your mental health. Okay, for me, I remember I was introduced to an app called Mindful Kenya. It's an app that it's kind of, what is it again? An anonymous call. You have to call someone and tell that person that you're going through something. Hello, can you hear me?
Yes, yes, I can.
You just have to mask, and then you're telling him or her what you're going through. For this, I figure out and I noticed that it's the best since a lot of men don't want to come out and say that I'm going through this and this and this because they're avoiding stigmatization and judging. So for the call, it really helped me. Another thing, I guess we're done. Yeah, they are just but to mention a few. Yeah, thank you.
Thank you so much, Mary. Thank you. I appreciate, all of the things that you shared with us. And while you were talking, one of the things that just kept coming to my mind is that some of these habits that you have suggested to us needs to be practiced over a while for you to start getting the benefits, things like affirmations. If you start immediately, your head may be telling you, oh, this is not working, this is not changing, and all of that. But then as we keep doing it over and over, you find that on your, at least that's my own experience, that on my not so good days, I find my brain, without looking for it, reminding me of those affirmations. So it's a long term in terms of building habits. There are short-term benefits, but there's also long-term benefits. I just wanted to put that out there before calling on our next speaker. Tanaka, I want to be sure that you're able to speak now, if this is a good time. Okay. All right. Thank you for being here. I am going to be asking you, some of the things. I love what Mary shared to us about Mindful Kenya, and those are some of the resources that people can go to. But for you as a professional also in the field, and someone with lived experience, where are, some of the readily accessible health points for men? Where can men who are facing mental health challenges go maybe for support? And what are some of those resources that you can recommend in developing healthy mental health habits?
I thank you so much for that question. And I know in the beginning of the call I hadn't said hi. Hello everyone in the call. My name is Tanaka and I work for an organization that works around gender diverse persons. So yeah, I'm gonna speak from a trans man perspective. And to answer the question, and I hope I don't sound redundant because my fellow panelists have, gotten everything spot on. So we definitely have acknowledged that we live in a society that praises hypermasculinity, that says that vulnerability or emotions or being emotional is equal to weakness. So what should men do, with the, what's it called? Where can men get assistance? Where can men get help when facing all these challenges that come from the stresses of life, that come from the stresses of just being a man and the pressures? For starters, um, you had talked about support networks, support, and it just clicked in my head that the need for support network is really very paramount for everything, for everyone. We are social beings and everything. And in the line of business that I do, we usually call that chosen families, having a chosen family, where we usually joke around here and there. Oh, I've gone to chill with the boys, but what are we really doing with the boys? Are we being mindful in those spaces? Are we holding space for our fellow brothers, for our fellow men in those spaces? The second thing now from a trans man perspective, because we come from, as me, I've come from a space where you're told, you're shunned, you're looked down upon because I was raised as a girl. So you're looked down upon because you're emotional, you're a woman, you're weak and all that. And then you come to this other side, or you come to your authentic self, and then you're told, if you do not box all of that and put them in the back of your head, you are less than, you are invalidated in your existence. So having a space where trans men, something in the lines of a rites of passage for trans men, where we talk about matters to do with healing justice, that is the communal care, talking about, being mindful, and talking about feminism and how can we have conversations around the benefits of feminism in being incorporated in men's mental health, and redefinition of manhood. Other than that, we've also talked about group therapy sessions that is under the support networks and individual therapies. I like what my therapist, because my therapist taught me about this acronym called RAINS, and I don't know if my fellow panelists or anyone on the call knows about it. It's an acronym that basically stands for recognizing what is going on with the emotions, and then allowing yourself to just experience the emotions, investigating the emotions and being neutral about it. There's this Buddhist quote that says, you're the mountain, everything else is a clouds. So, helping men understand that the emotions that they're going through is fine, and it's human. It's just part of the human diversity, is very paramount. And I think that ties into preaching the gospel of meditation. And I think my last point is around unplugging. We live in a society that is constantly just online and stuff like that, but unplugging and just being in the moment, and understanding that these challenges that you're going through, this whatever that you're going through, are human, just the same way as I said. Yeah. Other than that, I think in our context in Kenya, we have spaces. We have spaces like the what's it called? The public healthcare system, not as polished as it could be, but the spaces have actually started coming up and saying, putting men's mental health at the forefront, because the statistics are really alarming. Anyway, let me not blabber a lot. Thank you so much for the question, and over to you.
Thank you so much, Tanaka. Thank you for sharing so openly about your experience also and from your perspective as a trans man. I know I have a few follow-up questions, but I don't want it to be all about me. So I'll ask if there's anybody on the call who has any questions that they would like to ask. Okay, I can see Claudia's hand is raised. Claudia, please take the stage.
Thank you. So just first and foremost, thanks to everybody for arranging this webinar and for thinking about these kinds of questions and answers. So for me, I was just thinking about, like, just in general, right? Even with women, like we're always saying, we need to eat better, we need to go to the gym, we need to do yoga, we need to unplug, we need to do all those stuffs, we need to be socially connected with people so that we start feeling better. So I'm kind of, I mean, and this is just open for conversation to whomever, I'm thinking about that step before, where it's, at what stage does the person feel like they can reach out to somebody? Because before you even doing any of these things, you kind of have to be in that space to say, oh, I'm ready to look after me now, or I come first, or, you know, that sort of, I think that's just for everybody. It's not particular to gender, but having heard the things that we're mentioning, it's for all of us. But at what point, because I suppose it's so subjective and very individualized as to when you are ready. We all have lived experience, hence we're in this network together, right? So at different points, we decided we needed to get some help. You know, so I'm just a general sort of comment, maybe just thinking about that step before. At what point are we ready? And then is the other family and caregivers and friends, etc., are they ready to then help as well? Because sometimes there's that shift of, you're supposed to be a man and you're not supposed to be crying or feel sad. Now, how does the other side have to take on a different role? So these are just some of the things that were flagging in my mind as the conversation.
Okay, thank you so much, Claudia. So my speakers, I don't know if there's anybody who wants to respond. Deborah, Mary, Tanaka, okay. Jaleta has dropped off, but if there's anybody who wants to speak. Edwin, I can see your hand up. Do you want to respond or you want to ask a different question?
I wanted to say something different, but I also think I can maybe say something about that. I think I think I loved how Claudia has put it, that we need to be in that space where men are already empowered enough or have enough information to know when things are actually not okay and they can reach out. You get, and that now has to start being inculcated in men as they are growing up, that it is okay to go through certain issues, but at the same time, you can ask for help. And when you feel that you're at this point, there is support group A, there is Dr. B, there is friend A, there is community X where you can go in. But if we now, like, if I create a support group, for example, it's going to be very hard for men to just walk in, because at the same time, have I or have we as a society started changing the narrative that you know, it's okay to ask for help. It's okay to, you know, you can go through a mental health crisis. So I think that is how I would maybe not even answer, but respond to what Claudia has just shared. What I wanted to talk about are, I think, 2 or 3 things.
Edwin,
Oh,
can you hold on to, no problem. Can you hold on that? So let's wrap up on this conversation. I want to be sure that none of my speakers have anything to add. Then we can take on your next comment. while I wait for their response, I just wanted to say that riding on the rain technique that Tanaka mentioned when he was talking, rain, and I think that's what he said, rain, and I know the R stands for recognition. I think that's where part of the conversation, Claudia, and even what you just mentioned, Edwin, is with awareness is also to teach men to recognize that feeling a type of way. So, for instance, being not able to wake up early or not able to, sometimes even detaching from society, that isolation that you're beginning to feel, just recognizing that these are possible symptoms, right? That's usually the first step, really, that if we begin to teach about what are the symptoms, because a lot of times people are going through this, men especially are going through this, and they think it's just, yeah, it's just one of those things, it's just life happening, it's not anything I should worry about. So I think that just riding also on what Edwin said, that it's important to start teaching how do we recognize what are the symptoms, what are the things that when you see showing up consistently in your life, it's time to seek help. And the A for the rain is acceptance or allowing it. So I see that this symptom is showing up in my life. I allow it. And then I start asking questions, investigate and all of that. And yeah, I can see Tanaka putting it in the comment. There's neutrality, and there's another school of thought that also talks about nurturing. So I think that part of our conversation here, we started from nurturing, right? Nurture yourself by doing all of these things, but we didn't really talk about the RAI, which is to recognize, to allow, to investigate before you even start nurturing yourself by doing all of the things that our speakers have recommended today. So yeah, each one of us here are ambassadors in our own right. So that beginning to teach and talk about these symptoms and helping people recognize will be one step in the right direction, I believe. Yeah, I think I can see 2 hands up, but I'm not sure. Okay, so Deborah, I can see your hand up, so you can go maybe before, just if it's on this topic, so that when we go to Edwin, we know it's a change of conversation.
All right, I hope I'm still audible. It just started raining over here, so the network has gotten really shaky and all of that. But am I audible enough?
Yes, I can hear you. And I can see thumbs up from Zach, so I'm sure we can all hear you.
Can we hear me?
Yes, we can.
So I'm just going to say that
Ready to see.
Deborah, so we're struggling to hear you.
hello, am I audible now?
Okay, so now we can hear you, but when you start talking, then we lose you.
Okay, so let's try this again. Hopefully, you hear me all through. So, as I was saying earlier, yeah, I see the light of being ready to seek help in the same way or in the same circle of withdrawal from substance use. Not everything matches, but to some extent, there are some parts that matches. And this is me basically trying to say that determining when you're ready to seek help, it actually varies from person to person. But there's always a stage of pre-contemplation. That is just like you rightly stated, at least if I got you correctly just before my network started messing up, we're talking about the point of lack of awareness and then coming to a place of being aware. Yeah, so I think it starts with a pre-contemplation stage where you're not aware where there's a lack of information, where you're in denial. Something funny about admitting before even seeking help for mental issues is that you're in a stage of denial. To some extent, you know that, oh, something is wrong mentally, but at the same time, like, nah, maybe I'm just sad, maybe it's because of this. You start making up excuses, or maybe because of this or because of that, that's why this is coming up. And maybe if I'm able to get this out of the way, then I'll be totally fine. Then there's a place of contemplation, or now you're beginning to know. I don't know if I'm the only one who has experienced this, but there's something funny about the internet, and I always see it as, maybe the internet is actually watching us. Especially when it comes to like TikTok. You notice, I don't know if anyone has experienced this, when you're experiencing some form of sadness, and then all of a sudden you start seeing videos like, oh, maybe you're going through depression, signs of depression, days of depression, and and all of that on the internet. So at that point, the contemplation stage, you begin to get aware of the issue that, oh, maybe, okay, I've been sad for more than 2 weeks. I've been going through this for more than a while. And then you begin to gather information. Okay, what does it mean? I've not spoken to anyone in this amount of time. I've been sleeping too much for this period of time. What may be wrong? Am I sick physically? Am I sick in my mind? And then there's the point of preparation. You now know that, okay, you know what? Maybe, first of all, we should never ever Google our symptoms, because Google has a way of, blowing things out of proportion sometimes. But then again, there are times that, okay, you know that, okay, I've browsed this thing out. Maybe it's depression, maybe it's this, maybe it's that. And then you begin to acknowledge it. Actually, you decide that, okay, you know what, I want to seek help. And then that's when conversations such as talking to a friend, oh, I think I'm going through depression, talking to a family member, I think I'm going through depression, talking to one person that we may be close to, or the other person. And then after which there's a point of action beyond talking. But most people end up just in the place of preparation, where they know something is wrong and they may want to speak up about it, but don't go for that, seek help. That's the action part of it. I hope in all I was saying, I wasn't breaking again. Thank you.
Thank you, Deborah. At least we took the 3 phases: pre-contemplation, preparation, and then taking action. Thank you for sharing. Edwin, over to you.
What I wanted to maybe mention, I think we need to redefine, or rather understand the term vulnerability in its entire, in entire aspect, because I think people only understand vulnerability as when I will share about, for example, if it comes to me, I will only share about depression, my struggle with addiction, my suicide, and Edwin is being vulnerable. Or when I just call Jennifer and I'm like, Jennifer, this is a bad week, I'm struggling, yes, that is vulnerability. But what if have we looked at, because the aim of being vulnerable is also to be heard, at the same time for you to, and I think from my perspective, is for you to inspire people either to get help, or even for people to be able to support you better. Now, when I talk about that, I'm also going to use myself as an example. I'm a recovering alcoholic. I'm 9 years sober. So when I tell people that, I am 9 years sober, I don't even have to go into the details of how many times people found me in a ditch. But I will tell you that I'm 9 years sober. And I think that is me being vulnerable enough and telling people that, you can actually beat your addiction. That is me being vulnerable. When I tell somebody that, yes, I identify as a person who has ADHD, and I'm living a good life. I'm enjoying life. I mean, so it doesn't mean that I'm not being vulnerable about my struggles, but I think we need to look at vulnerability in terms of how important it is both in both sides of the of the divide, because I don't want people to think that you can only be vulnerable when you're in a dark place and you have to share. And some of us who have gone through very rough times, and I believe most of us have, at times when it is really in the thick of it, you don't even want to talk. You get. But then when we find recovery, we find that when I tell somebody I am 9 years sober, and that person is inspired, maybe wants to get help, maybe has a person, and I think that is vulnerability at its best. Now that is about vulnerability. There is something else, and I think people have used this so many times. And I know so many people, even before we knew how to go about things, we told people to man up, to man up, to man up. And I'm of the contrary opinion, because I know people say, do not tell people to man up. But look at my experiences. I went to rehab. I am currently on medication. When things are rough, I'll talk to my therapist. When they are even worse, I will talk to Zach, Claudia. I mean, I have talked to them. They can say, you know. So that is me manning up. So I think we also need to look at it from that angle, because, and I, like somebody like Tanaka, I know the country we live in, and I know people can even look for you and actually want to kill you, because they'll come with all these religious titles and all of that. So I think I am very proud of you for even sharing this. And I am happy that we met in South Africa, and we are from Kenya, and we have never met in Kenya. Hey, that's bad, but we are going to meet soon. But what Tanaka shared, you get, that is him being vulnerable and also manning up. When I tell people, okay, my daughter is here and she's making noise. Just a minute, guys. The joys of being a father. I'm back. So me telling somebody that, okay, today is a very rough day and I think I need to talk to my psychiatrist, I need to talk to my doctor, or I need to do something because things are really bad, that is me manning up. So we also need to find ways of how to, because I don't think people will stop telling people to man up. But how are you telling people to man up? I'm telling Zach to man up, but I'm also holding his hand and I'm telling him, let's go and see this support group, because we are both in this space and we can maybe benefit. But not manning up and telling you, okay, let's go and take more beer so that we can, you know, not know where we are going with our lives. It's manning up with a purpose. It's manning up by, you know, telling people that when on rough days, maybe I'll rush to the gym. That is me manning up. And also manning up, maybe it is like taking charge of your life. And I believe all of us here, even for the women, we have manned up one way or the other, because we have gone to get help, and it is not easy. It's very hard for any of us to walk to a doctor and tell them, okay, it's back again. I'm feeling depressed. I'm feeling suicide. I think I'm done.
Yeah,
Thank you, guys.
thank you so much, Edwin. I think the biggest thing I'm taking from everything you said is redefinition. You know, we have to redefine the words that we use and give them new meaning. When we say vulnerability, we have to redefine what that looks like. And for the positive ones, which is, or those who are overcoming, sharing their story will inspire those who are not there yet to share their own. And of course, manning up, I really love that will redefine what that looks like. So it's not toxic, but it's positive. Thank you to everyone who is on the call. I know we're right out of time right now. We'll be rounding up. I'm just looking at the chat if there was anything else. I'm not sure there's anything else I missed. Oh, Claudia, you had said something about sharing the RAIN concept with the CLC. So the RAIN technique is popular in meditation circles. At least that's how I came to know about it. So it's a meditation technique to help you go through your emotions per time. But because it's a mental health tool, you find out that you can use it in different ways. But maybe you and I can, you, myself, and Tanaka maybe can see what we can put together to share with the CLC after now.
Yeah, that would be perfect. Thank you.
Thank you. Is there any, before we round up, this is really the end. I appreciate everybody's time. Thank you for your contributions, to our speakers, to Edwin and Claudia for such rich contribution, and comments. Thank you, thank you, thank you.
Thank you for hosting
any
and
last
moderating.
word? My pleasure. Okay, in the absence of anything, I'll say have a wonderful rest of your day. Wish you the best, and I hope that we'll take all of the things, the insights from this conversation and share it with our different networks, our individual networks and countries as well. Have a good day, everyone.
Thank you. Bye.
Bye.